Most people at the moment who end up involved in clinical pharmacology do it because they have experienced someone inspirational from the world at some point in their career. And for me, it was Emma Baker. I happened to end up in a research group with her. I was actually an emergency medicine trainee, but as soon as I started working with Emma, the possibilities that she laid out in front of me for a career were just amazing, and her career indeed was inspiring. What she has done both in research and in education, it just made me want to be like her, and I think that's often the case for clinical pharmacologists. I definitely had lecturers at university who were clinical pharmacologists, and they always seemed like this sort of otherworldly beings of high levels of intelligence, and I spend my life disproving that theory that clinical pharmacologists are all super clever people, because I certainly am not.
The first clinical pharmacologist I remember meeting was Professor Nick Bateman, and when you meet him, you were sort of blown away by his enthusiasm and just thirst for improving the practices around him. And whenever you meet somebody like that in a clinical environment, it's unfortunately a real rarity now. And I was completely struck by this man. I just thought he's just such an unusual doctor, an unusual way of looking at things, and regardless of whether you're on a post-take ward round at the crack of dawn or whether you're sitting there thinking about sort of the next clinical trial in toxicology, he was equally enthusiastic, and that sort of won me over. The other gentleman that has sort of continued me on that sort of theme is David Webb, and I think the qualities that I admire the most is that he's able to ask the pertinent question regardless of whether you're talking about basic science at a bench top or whether you're talking about drug regulation at a national level, and that to me is just a real rare skill.